Hello everyone, I'm Dr. Mira Tan, board-certified urologist. Today we're talking about a very important and very natural topic, how to masturbate safely after the age of 60, and the 3 big mistakes you absolutely must avoid. This video is educational, medically accurate, and designed to help older adults maintain sexual wellness confidently and safely. As we cross the age of 60, our bodies change in ways that can affect sexual health, even if we remain mentally and emotionally young at heart. One of the most important things to understand is that masturbation is still a healthy, natural, and beneficial activity in later life. It improves blood flow, supports hormonal balance, reduces stress, helps maintain erectile function in men, and helps preserve pelvic floor strength in women. But after 60, the body's response to stimulation changes, and ignoring these changes is one of the biggest reasons older adults injure themselves or develop discomfort. Let's start with what changes physiologically. For men, testosterone levels naturally decline with age. This affects libido, erection firmness, and the time needed for arousal. The penis becomes more sensitive to friction injuries because skin elasticity decreases and blood supply is slightly reduced. Erections might take longer to develop, and staying hard may require more stimulation or longer warm-up periods. This is completely normal. For women, menopause leads to reduced estrogen levels, causing natural lubrication to decrease and the skin of the vulva and vagina to become thinner or more delicate. This means direct friction, especially without proper lubrication, can cause micro tears or soreness. Again, this is normal and manageable. Neurological sensitivity also shifts with age. Nerve endings can become less responsive, meaning you may need gentler, slower, or more deliberate stimulation rather than quick, intense motions. Joint stiffness, arthritis, limited mobility, or chronic conditions like diabetes and hypertension can affect the way you position your body, grip your hands, or maintain comfort during solo intimacy. Why does masturbation still matter at this stage in life? Because sexual health is deeply tied to overall health. Regular sexual activity, including self-stimulation, helps maintain cardiovascular circulation to the pelvic area, which is crucial for erectile function and vaginal health. It also releases endorphins and oxytocin, chemicals that improve mood, reduce anxiety, support sleep, and strengthen emotional well-being. Many individuals over 60 are shy or hesitant when discussing masturbation, but there is no reason to be. Medical science is clear. It is safe, healthy, and beneficial, provided you adapt your technique to your body's needs. That adaptability is essential. Using techniques from your 20s or 30s on a 60-plus body may lead to irritation, pain, or injury. In this video, we will explore not only how to masturbate safely, but also the 3 major mistakes that people over 60 commonly make. These mistakes are easy to avoid once you understand them, and avoiding them can dramatically improve your experience while protecting your health. So before we jump into practical safety tips, it's important to appreciate that your body isn't failing. It's simply evolving. And with the right approach, pleasure can remain a joyful, satisfying, and safe part of your life. One of the biggest differences in masturbation after 60 is the need for preparation. When you were younger, arousal might have been instantaneous. A few seconds of stimulation could lead directly to erection or orgasm. But after 60, your body needs more time to warm up, and skipping this warm-up is one of the primary causes of strain, soreness, or erectile difficulties. First, let's talk about blood flow. Sexual arousal depends heavily on healthy circulation. Before masturbating, it helps to warm the body gently. This can be as simple as taking a warm shower, using a warm towel, or spending a few minutes doing deep breathing to relax your muscles. These small steps increase blood flow to the pelvic area, making arousal easier and reducing the risk of tissue irritation. Lubrication is another essential part of preparation, especially for women and men with sensitive skin. After 60, the body produces less natural lubrication overall. Dry friction, even for a short time, can cause micro tears in the skin, making you vulnerable to irritation or even infection. Using a high-quality, body-safe lubricant significantly reduces this risk. Water-based lubricants are the safest for most people, while silicone-based lubricants last longer and require less reapplication. If you're using your hands, apply lubricant generously. If you prefer toys, make sure the material is compatible with your chosen lubricant. Avoid petroleum jelly or lotion, as these can cause irritation or damage certain materials. Mobility is another factor. Arthritis, joint stiffness, or muscle tension may limit certain positions. Rather than forcing your body into uncomfortable positions, choose a comfortable environment, like a bed or recliner, and use pillows to support your back, knees, or elbows. Comfort directly affects arousal. The more relaxed you are, the better your experience. Another valuable step is slow arousal. After 60, nerves respond best to steady, gradual stimulation. Start with gentle touch, exploring temperature variations, or using a light massaging motion instead of jumping directly into intense friction. Many older adults report that slow, rhythmic stimulation leads to stronger, more satisfying orgasms. Finally, mindfulness can play a huge role. Focus on breathing deeply and allowing your body time to respond. Tension reduces blood flow and makes arousal harder. Relaxation enhances pleasure. By preparing your body properly, warming up, using lubrication, ensuring comfort, you are not only increasing pleasure but preventing the injuries and mistakes that we will discuss later in this video. Now let's talk about safe, medically recommended masturbation techniques for adults over 60. Again, nothing explicit, just health-focused guidance designed to protect your body. For men, the key is gentle, controlled stimulation. Avoid tight gripping, which is a common issue known as death grip syndrome. This can desensitize the nerves over time, making natural sexual activity more difficult. Instead, use a relaxed grip, apply lubricant, and use slower, more rhythmic motions. Experiment with varying pressure instead of intensity. Engaging the pelvic floor through breathing or Kegel exercises can also support erection strength. Some men benefit from using masturbation sleeves designed for sensitivity training. These can help maintain softer pressure while providing an even distribution of stimulation. However, avoid devices that apply excessive suction or tightness, as these may cause bruising or damage fragile skin. For women, the most important factor is lubrication and gentleness. Vaginal tissue after menopause becomes thinner, and even light friction can cause irritation. External stimulation is usually safer and more comfortable than internal stimulation, although both are fine if done gently and with adequate lubrication. If a toy is used, ensure it is smooth, made of medical-grade materials, and not too large. Warm it before use to relax the tissue and increase comfort. For both men and women, pelvic floor engagement helps enhance pleasure and reduce strain. Gentle breathing, inhale through the nose, exhale through the mouth, relaxes your abdominal muscles and improves circulation. Another helpful technique is stimulation variation. Instead of repeating the same movement continuously, vary the speed, pressure, and rhythm. This reduces the risk of overstimulating one area and causing numbness or soreness afterward. Avoid using objects that are not designed for sexual use. This is one of the most common causes of injury across all ages. Finally, pace yourself. After 60, orgasm may take longer to achieve, and that's perfectly normal. Rushing can lead to overstimulation, chafing, or disappointment. Masturbation is most satisfying when you allow your body to respond naturally rather than forcing an outcome. These techniques ensure safe, comfortable, and pleasurable solo intimacy while respecting the needs of your body as it evolves with age. Now let's discuss the 3 major mistakes people over 60 commonly make when masturbating and how to avoid them. Mistake number 1. Using too much force or pressure. As skin thins with age, intense friction can cause irritation, bruising, or nerve desensitization. Men often grip too tightly. Women may apply too much direct pressure on delicate areas. This leads to soreness that can last days. The fix: use plenty of lube, soften your grip, slow your pace, and prioritize comfort rather than intensity. Mistake number 2. Skipping warm-up and lubrication. Younger bodies produce natural lubrication and respond quickly. After 60, this changes. Without warm-up, blood flow is limited, Nerves react slowly, and the skin is more vulnerable to friction injuries. The fix: warm the body first, use lubrication generously, and begin with gentle, slow stimulation. Mistake number 3: using unsafe objects or outdated techniques. Many injuries happen when people use objects not designed for sexual activity, or when they try to replicate their techniques from decades ago without adapting to current needs. Your body now requires gentler, more mindful stimulation. The fix: use only medically safe toys, prioritize comfort, and modify your technique to suit your current sensitivity and mobility. Thank you for watching. I'm Dr. Mira Tan. Sexual wellness is lifelong, and with the right knowledge, pleasure and safety can stay with you at every age. If you found this helpful, subscribe for more health-focused videos.